little later than normal, but I'm excited to be joined by Dr. Niteesh Bharara. I'm sorry, I got your name wrong, even though I practiced. You are the Director of Regenerative Medicine at the Virginia Spine Institute. Thank you so much for joining us tonight.
No, thank you for having me.
Just to kick us off, I would love for you to just give us a brief description of what you do at the Spine Institute and how you got into medicine.
Yeah, so again, my name is Niteesh Bharara. So I'm a physiatrist. What a physiatrist is, it's a physician that works on restoring function. So went to medical school, and then I did a residency in physical medicine rehabilitation at Temple University, in which I finished up as the chief resident. And then I went on and did a specialty training in interventional pain management. And this is a field in which we use our different techniques and procedures to recover from injuries and various other conditions and minimize overall pain. That was a interventional pain management and also spine and spine and musculoskeletal medicine as well. And so I finished up in Philadelphia and finished my training there. And then I ended up joining the Virginia Spine Institute. And we're a multi-specialty practice in which we take care of all spine-related issues, and we do it with a multi-specialty approach to it. So it's not just surgical, it's not just non-operative, but we have neurology as well. And I concentrate a lot on regenerative medicine, and a lot of people don't know what regenerative medicine is, but it's essentially I perform procedures that allow the body to heal itself. And some examples of these would be like non-embryonic stem cells, or something called like platelet-rich plasma, or PRP. And so that is what I do, and I take care of a wide range of patients, from adults to children and adolescents. And just to get back to what you were asking about how I got into medicine, well, actually I injured myself pretty terribly in a soccer incident, and I had surgery, and I never really got back to what I wanted to do. But I met a physical medicine rehabilitation physician who got me there and showed me the path, and that's kind of what I've taken over, and now I can use what he gave me to help my own patients.
Oh, that's really cool to have a personal story that sort of leads you into what you do for a living. One of the themes, or the theme for the month of April, we're at the tail end here. We're barely making it into April, but our theme was working with adolescents and children. And so what kind of experience have you had working with adolescents and children, and how is that sort of different than working with adults?
Yeah, so as I mentioned before, I myself was an adolescent patient, and I had that experience of that soccer injury, and getting back to full force to get back to sports and to my life. I believe all the difference was meeting that physician who came up with my treatment plan and took me seriously. And so these are some of my favorite patients. Adolescents and children are some of my favorite patients to take care of. They're challenging, but they're some of my favorite patients. So all these patients that come to see me, they one have had chronic related problems. They're usually adolescents and children get better if they have just some musculoskeletal problems like spine pain. That gets better in a few days usually, but if it lasts for more than just a few days, that could be a significant problem. And so we all want to get better quickly and get through our pain, and we just think we just work through it. But with children, if they're having a problem, we need to get that diagnosis very quickly. So I see patients. I rarely see them in the first few days of their injury, but I see them later on in their injury. And I think it's very important that we address these issues early on, because all healing times are different, and patients heal at different rates. But we need to take care of these adolescents and these children, because some of their problems can be very significant. And so I've gotten to take care of all related issues, from issues like scoliosis to a overuse injury from an elderly, an older child. So depending on the age of the child, you have different diagnoses and different types of problems that arise.
Now, are most of the kids that you see, are they coming in for injury? Are they coming in for more like skeletal issues that are from something else?
It's a great question. So it depends, and usually your younger patients are the ones that don't really necessarily have an injury, but they come in with some sort of pain that just won't go away, and many times they get the parent has given it the correct amount of time, and it just will still won't go away, and then they come in for trying to figure out why this child has pain. Then you have the a little older children who potentially got injured with a sports-related injury or an overuse injury, or they're wearing their backpack wrong. Something, there's an inciting event to it. So you get a wide range of complaints. You have to tease through them to kind of figure out what exactly caused it.
That makes sense. You mentioned the backpack, and I know kids are not in school right now. Obviously, it's a weird time in the world, but eventually they'll be going back to school, and that is one thing that we kind of touched on earlier this month. What do you see most from like backpack stuff? What do you see kids doing that they need to change?
Yeah, so it's a big problem, and it's something that we don't talk about enough. Children normally have backpacks that are about 20 to 40% of their total weight. I mean, just think about that. That is a large amount of weight that's sitting on their back. And many of them will wear it on one shoulder, or they wear it very low and they let it sag. And we don't want that. We want to be able to distribute that weight between their entire spine. So we like them to have backpacks that have padding from their shoulder straps. We want to wear them. We want the backpacks to be worn on both shoulders to distribute that weight as much as it can. And if you had a waist strap with it, it's even better. But I know a lot of kids don't like to use a waist strap. It's also very important that the backpack is hugged closely up against the back and not letting it sag, because this can actually pull the spine back and cause other related injuries. We see a lot of sprains and injuries that come because of improper backpack wear. It's also really important to pack the backpack appropriately. Only pack the books that you need, and try to minimize the load that you're putting on your body 5 days a week.
Yeah, I'm having bad memories of middle school and me trying to be cool, wearing my backpack on the side. Like, no wonder I have problems today, but that's a really good reminder. One other thing I would love if you could touch on is text neck. I'm sure that has become just a growing problem. How much do you see that as a problem in kids? And then I'm sure adults also have the same issue.
Yeah, usually, this is a problem that we see both in kids and unfortunately adults. And in kids, many times they can work through text neck, which is irritation to the muscles or the facet, the joints in the neck, and because of the positioning, this chronic positioning of what they use their cell phone, their smartphone, or from texting or using any other social media, whatever they decide to use. But we see this in adults as well, and we see it in adults probably more frequently than we see it in kids, because adults already have the normal wear and tear of their neck. But in kids, because they're using these devices so frequently, we see them in kids all the time. So it's really important that we work on posture and proper use, and take breaks from using your smart devices and going on your social media, especially during this time when maybe things aren't as busy as usual.
Yeah. One other thing, I mean, you mentioned injury. That's a huge one, especially for like high school athletes. They're doing all kinds of sports. And then something someone mentioned the other day was just that because of this weird time that we're going through, maybe kids are not doing sports. And then when life gets back to normal, maybe they're going to get into it too fast, too much, too soon. What are, some of your top recommendations for high school students that are in, sort of serious sports teams? How can they prevent injury?
Yes, so this is going to be a problem because they have not trained, and they've basically been sedentary for several months at this point. So when they're getting back into their normal high-level sports, and they're getting back into actually playing, we want them to be able to practice before they get back onto the field, because we really need to get them back in shape using the correct muscles that they're using during an actual athletic event. So making sure that they have the proper rehab or prehab before getting back into sports is extremely important. Making sure they do this for an appropriate amount of time. We all want to get back to doing things that we were doing before, but we need to do it in time, and we need to make sure we take the time to regain the strength that we lost and to do the activities properly. And we're going to see this not just in kids, we're going to see this in adults as well, in which we're going to get back to running even though we stopped running. We're going to get back to playing basketball even though because the gyms were closed. We're going to be back going 5 days a week. We just can't do that. There's going to be a lot of injuries that are going to come from it. So, preparing yourself with the proper exercises and getting back your strength is going to be really important. And also setting your schedule is going to be important too. Don't go back to 5 days a week. Go back 2 days a week and gradually increase your frequency of these activities. And I think it's going to be really important with kids and adults.
Yeah, I think that's a good point. I follow several professional athletes online, and a girl that I followed the other day, I think her baby is like 18 months old, and she was posting about, I'm just getting back into some hardcore core stuff. And I know that's not a kid thing, but I thought it was a great example of looking at people that actually do this for a living, that really treat their bodies well, and realizing that we as amateurs should be doing, the same things, if not more, to protect ourselves. So I thought that was really interesting.
Absolutely, and I think kids. I just saw two young kids today, and they're both getting back into their gymnastics program. Well, hopefully within the next couple of weeks. But they have not done anything within the last 2 months, and that is a setup for disaster, setup for an injury, a fracture, a pars fracture in their spine, or some other injury to their spine, because they have lost some of their flexibility, and that was very evident on the examinations today. So I think it's extremely important to regain your flexibility, your stability, before you go back and you just do everything you can do. And children really aren't aware that they can't go back at full force, and we as the adults need to really make sure that they do it properly.
Well, that kind of speaks to my last question, which is, if you could, I'm assuming that we're going to have some parents watching, parents of kids. What would be your message to parents just about this whole topic in general and how to protect their kids?
Well, it's very challenging to tell a child that they can't do something right away. And I see this all the time when I'm seeing patients or children that have injuries, and I tell them, you actually can't get back to playing this season. You need to take the season off, and so you can get back next season. It's going to be very challenging for parents to go and tell their children that we need to take this slow. We need to get back into our exercise routine at the pace that your body tolerates. And so doing this is going to be really, really, really important. We also need to get them back into game condition by doing it in the proper environment, not just in your yard, but we need to get back to the correct game environment. So a correct soccer field or a basketball court. And we need to use the equipment, the correct equipment that they're going to be using in the games. We need to be using the correct protection equipment. So it's very important that we do all that to protect our kids. And that's not going into, some of these high impact activities that may result in a concussion, or some of these activities that aren't high impact activities that maybe a child won't tell you that they got injured, that they'll just kind of fight through it because they just love what they're doing. But we as adults need to continue to watch them and make sure they're not grimacing when they're doing certain activities. And if they are, we need to pull them out of it, and we need to get the proper help.
Yeah, and set a good example by not doing it ourselves.
Exactly.
All right. Well, Dr. Bharara, thank you so much for joining us for this interview. I think it was really informative, and we just appreciate your time.
Absolutely. Thanks for having me.